Assalamualaikum and hello to everyone. My name is DANIAL ZULQARNAIN bin Muhammad Shafiq ABDULLAH and I'm a first year medical student. My matrix number is BM24110063. So today I'll be talking about pulmonologies, where I'll be give you an introduction to the respiratory system, which is one of the most vital system in the human body. So first, we will look into my content, which include introduction, anatomy, function, biochemical process, disease related to the respiratory system, treatment, and also specialists in pulmonologies, and lastly, my reference. So first of all, what is respiratory system? So the human respiratory system consists of our lung, our airway, which is trachea, bronchi, and bronchiole, our diaphragm, our larynx, our throat, our nose, and our mouth. So the main organ, lung, are paired, cone-shaped organ that is located in the thoracic cavity and are protected by the rib cage. So the main function of respiratory system is to breathe in oxygen and breathe out carbon dioxide. So let's take a closer look at the anatomy. So the respiratory system is divided into the upper and lower respiratory tract. So the upper respiratory tract consists of nose, pharynx, and larynx, which will filter, warm, and also moisten the air that we breathe. Meanwhile, the lower respiratory tract that begin with trachea and extend into the lung, where we will find the bronchi, bronchioles, and alveoli, which is the site of our gas exchange. Next, our lung are divided into loops, which are slightly asymmetrical due to the positioning of other organ. For example, our right lung has three lobes, which are the superior, middle, and inferior lobes, and it is separated by the oblique and also horizontal fissure. While our left lung has two lobes, which is superior and inferior lobes, and it is separated by the oblique fissure. Interestingly, the right lungs are wider and broader than our left lung, but it is shorter due to the liver that is situated just beneath it. So, this makes it easier for foreign particle and pathogen to enter the lung, our right lung, which will potentially increasing the risk of infection or other complications such as bronchitis. Next, let's zoom in into the alveoli, which is the tiny air sac where the gas exchange takes place. So, these structures are vital for oxygenating our blood and removing our carbon dioxide. So, there are two main cells in alveoli, which are type 1 alveoli cell and type 2 alveoli cell. So, type 1 alveoli cell are squamous pulmonary epithelial cell and it helps in gas exchange. While the type 2 alveoli cell, also known as septal cell, and is secrete alveolar fluid called surfactant. So, surfactant will is essential because it will reduce the surface tension within alveoli and it will prevent the collapsing of alveoli when we exhale. Lastly, we also have alveolar macrophage, which are dust cells that will remove fine dust particle and microorganism in our lung. Next, we have diaphragm. The diaphragm is a dome-shaped muscle that separates our thoracic cavity and our abdominal cavity. It is the primary muscle that is responsible for breathing. So, moving on, the lung will surrounded by double-layered membrane called the pleura, which play a crucial role in respiratory function. So, the parietal pleura is the outer layer, while the visceral pleura is the inner layer. Between these two layers is a small space called the pleural cavity that is filled by pleural fluid. So this fluid will act as a lubricant that will reduce friction during breathing. So if the pleura become damaged or it's get inflamed, it can lead to conditions such as pneumothorax, where the air will entering our pleural cavity, causing our lung to collapse. Next, there is also intercostal space. So the intercostal space is the area between the ribs that is filled by muscle, nerve, blood vessel, and also connective tissue. It plays a key role in the mechanic of breathing. So intercostal space is filled by muscles such as internal intercostal muscle that help the rib move superior during inspiration, and also internal intercostal muscle and innermost intercostal muscle that help the rib move inferior during expiration. Lastly, there is also intercostal nerve and associated major arteries and vein that lie in the costal groove of our ribs, and it passes in the plane between the inner two layers of our muscles. Next, we'll be talking about the histology of our respiratory system. There are two portions, which is conducting and respiratory portion. The conducting portion start from the nose down to our terminal bronchiole. It is a pseudostratified ciliated columnar epithelium with goblet cell where it will conduct air from atmosphere to our lung. It is supplied by the pulmonary arteries, whereas our respiratory portion is include our alveolar duct and our alveolar sac. It is simple squamous epithelium, where its main function is for gaseous exchange, and it is supplied by a bronchial artery. So next, I'll be talking about the function of the respiratory system. There are a lot of functions of respiratory system, such as to allow for gas exchange, to help regulate blood pH. It also contains receptor for sense of smell, filter inspired air, produce vocal sound, and also secrete small amount of water and heat. So, I will be talking about biochemical process of our respiratory system. The biochemical process that I take is gaseous exchange. So, here the oxygen and the carbon dioxide will be diffused from area of higher partial pressure to area of lower partial pressure. So, there are two respiration, which is external and internal respiration, whereas the external respiration take place between alveoli and pulmonary blood capillaries, where the internal respiration take place between systemic blood capillaries and tissue cell. So, for example, in internal respiration, the pressure of oxygen pumped into our systemic capillaries is higher than the pressure in tissue cell, because our cell is constantly using oxygen to produce ATP. And also our carbon dioxide in the tissue cell is higher because the tissue cell is constantly producing it. So it is higher than our systemic capillary blood, which is why in internal respiration the oxygen will go into the tissue cell and the carbon dioxide will go into the systemic capillary. So, how is the transport of oxygen and carbon dioxide done? So, the transport of oxygen, there's only 1.5% dissolved in blood plasma, whereas the remaining 98.5% will bind with hemoglobin to form oxyhemoglobin. And the transport of carbon dioxide, there's only 7% will be dissolved in blood plasma. 23% will combine with hemoglobin to form carbaminohemoglobin, and 70% will be converted into bicarbonate ion. So next, I'll be talking about the disease related to the respiratory system, which is the emphysema. So emphysema is a chronic obstructive pulmonary disease, COPD, that will get worsen over time. So in our healthy lung, this alveolar sac will stretch and will be filled with air when we breathe in. And this elastic sac will help the air lift when our breath out. But when emphysema occur, the alveoli will be damaged and will cause them to lose elasticity and create larger space in the air sac. And this will make it harder for our lung to exchange oxygen and carbon dioxide, as it is less elastic and it doesn't leave room for fresh oxygen-rich air to enter our lung. So, what is the causes and symptom of emphysema? So, the causes of emphysema, it can be result from long-term exposure to airborne irritant, such as smoking cigarette, or we inhale chemical fume, vapor, or even dust. And the symptom for emphysema is shortness of breath, or when we wheezing, whistling, or squeezing, there will be sound when our breath out, or chest tightness or heaviness, or we will be even feeling tired, or there will be even weight loss or ankle swelling when our condition get worse. So how to diagnose emphysema? So we can use technologies such as chest X-ray and CT scan to diagnose emphysema. For chest X-ray, it may show some lung change, but it may also not detect our change in our lung even if we have emphysema. However, for CT scan, it will give much more greater details of our lung change than a chest X-ray does. A CT scan can show if you have emphysema or not. And it can also help you to decide if you do surgery, will it gain benefit for you. So next, we can also do lung function tests to diagnose emphysema, where it will measure the amount of air we can breathe in and breathe out, and whether our lung will deliver enough oxygen for our blood or not. So next, I will be talking about the treatment to emphysema. So the treatment to emphysema, it is based on how severe our symptoms are. So for example, we can change our lifestyle. For example, we can quit smoking and also avoid places that are polluted. And we can also take meditation such as bronchodilator, which will relax our muscle in the airway to improve our airflow, and inhale steroid, which will reduce the airflow inflammation. We can also take antibiotic to treat our lung infection. And if our emphysema is worse, we can do surgery such as lung volume reduction surgery to remove the most damaged part of the lung. And also we can do lung transplant. So, to prevent emphysema, first, don't smoke. Second, we can stay away from secondhand smoker. And third, we can wear a special mask or do other measure to protect our lung if we are working with something that involve chemical fume, vapors, or dust. Lastly, I will be talking about the specialists in pulmonology. So I'll give two specialists in pulmonology, which are Prof. Erkan Yildirim and Dr. Alfian Ibrahim. So Prof. Erkan Yildirim is an expert in thoracic surgery, where it is recognized for achieving Turkish thoracic surgery proficiency certification. Whereas Dr. Alfian Ibrahim is a Malaysian surgery, will get his Bachelor of Medicine and Bachelor of Surgery MBCHB in the UK, and also it get a qualification for membership of the Royal College of Physicians in MRCP in the UK. So, Dr. Alfian Ibrahim can speak three languages, English, Malay, and Mandarin, and it get its bachelor in University of Wales, UK, and its specialization in Royal College of Physicians, UK. Dr. Alfian Ibrahim is also a subspecialist in respiratory system. So this is all the reference that I use to do my SSM assignment. And I think that's it for me to in my talk about respiratory system pulmonology. I think that's all. Thank you so much.